Yes, a very good evening to you tuned into UBC TV. We thank you so much for following all our programs and welcome to this particular edition of this week of UBC One-on-One with Michael Jordan Lukomwa. Like I always say, we discuss a variety of issues, and in that line we host different people who have the information we need from different lines of life and for the good of you, myself, and everyone. Now, we have adolescents in our families, but these young people are exposed to a lot, especially a lot to do with reproduction. But they have a right to be protected from whatever risks that involve this life involves, and we have to know what leads them to the exposure into this problem. Anyway, who has the right and responsibility to protect them, guide them, and all things to do with that. So this evening we are going to talk to a group of people that have a project that focuses mainly on young girls, adolescent girls, who have dropped out of school, but they are having that exposure to too much of reproduction and issues to do with reproductive health among adolescents. Yes, they look at the girl child, but as well not leaving out the boy child. They are She Soars, that's the name of their project, and they are at Mbuya Community Health Initiative. I have their lead, the leader of the project. Her name is Miss Nantondo Rebecca Bagala. We are going to get more about the project and these young people from her. Madam, you're most welcome to the show.
Thank you, Jordan.
How are you doing? And thank you so much for coming in.
You are welcome.
Yes, we have heard about this project, but let me start with reproductive health. I want somebody watching us to follow from step one till where we'll end so that we talk to somebody. When you talk of reproductive health, what exactly is meant? What is reproductive health?
In simple terms, reproductive health is just a component of the bigger word health. Okay. Which basically looks at reproduction. That's how people meet, how they get the offsprings, the whole activity. Looking at a mother or a father, parents at large, but also the siblings that they get out of the action. So to me, that is reproductive health.
Okay. Now, we are talking about reproductive health among adolescents.
Yes.
When I talk of an adolescent, this is somebody between the age of 10 and around 19. Yeah. These are supposed to be children under somebody's care. Is it right to put them in the same sentence with reproduction, yes, which you say, with reproductive health, which you say is reproduction, which reproduction means having offsprings, children, yet they are also children. How do they get to relate?
It's so surprising, but it's really a fact currently in our country that you would find that one of the biggest problems or challenges we are facing, we are seeing many adolescents becoming mothers, becoming parents. If he's a boy, he becomes a father, a young father or a young mother. So it's something that we really need now to talk about openly. Unlike before where we used to hide, you shouldn't talk about issues of reproductive, sexual, and so forth. Currently, the fact has really come out that most of adolescents are pregnant. In fact, statistics says that 1 out of the 4 adolescents, 1 become pregnant every year.
Really?
So just look at that magnitude. And that alone prompts us to start to have discussions about reproductive health in adolescents. And of course, more worse in adolescents that are out of school, because their counterparts that are in school, they are kept in school. Being in school alone
somehow
saves them. But just look at an adolescent that is within our rural, urban kind of setting, or the peri-urban areas, yes, where you really find a lot of children who are not out of school. What keeps them active in there? So they resort into early sexual debut, which prompts them to get other challenges out of that.
Okay. So reproductive health among adolescent girls who are out of school.
Out of school.
Now, yes, these girls are out of school, but what exposes them to reproduction and sexual life early? Does being out of school mean somebody will necessarily involve in sexual activities?
It may not be the results for them being out of school to be to start sexual activity early, but of course we are looking at other predisposing factors that would lead this adolescent out of school to be engaged in early sex. One, you'll find that they lack information. You may say, how do they lack information in this kind of .com world? But just look at how many adolescents that are able to access smartphones. How many adolescents can be able to go into a cafe and start searching about issues related to reproductive health. So lacking information is one of the things that they really don't know what to do in a specific situation. So that alone puts them at a risk of them being into early sex, having early engagement, getting early pregnancy, getting sexually transmitted diseases that are not probably diagnosed early. And of course that's one. Two, you look at unlike before, where we used to have parents sitting with us and they tell you, if you do this, this may happen, please be able to do this. The current generation parents are busy, they're on the run. They are looking for money. They don't
have the time to
talk such to their children. They do not have money. And that's why some of these projects, some of these programs are coming in to play a role in helping these adolescents be given information, be directed on what to do. On top of that, you also look at if an adolescent gets into an adolescent out of school, their discussion will be totally different. You'll be able to discuss a lot of issues concerning their sexually reproductive health that we as parents or service providers, we have not discussed. So I hope this is not too late for us to start discussing about that and see how this direction can probably change. Because you remember, these children are our future generation.
Some of these children drop out of school still due to sexually related stuff.
Yeah.
Somebody has gotten pregnant, and definitely she finds herself out of school.
Yeah.
Then others are living in communities where a lot of things have happened.
Yeah.
How come, and this is at an age where someone's mind is active, how come we still say they lack information on how to keep themselves safe from being exposed to the risks that come with early engagement into sexual activities?
There are two things here. There's engaging into early sex when you really planned it. But there are adolescents that engage into sexual intercourse, which could be protective in kind of say. That even if I'm going to engage into sexual reproduction, I could have prevented myself from getting pregnancy, I would have prevented myself from having sexually transmitted infections. So some of this information, they do not have it. They lack that kind of information. And this is a gap that me and you, we need to bridge and see that we help these adolescents out of that.
Who is to blame for this exposure of these young people to the sexy life that leads them into the challenges that we are talking about?
It's quite a difficult question, but I really think all of us, we need to be blamed.
No, but there are people that are closer to them, I think.
Of course, being that you are an adolescent, your sexual activity increases, you know. Of course, we wouldn't blame the adolescent at that level, but I'm looking at the parent. We have not guided, or caretakers, we have not guided these adolescents on what to do in specific situations. So to me, a parent, I would blame a parent, but of course, I would also look at the health care providers. I've seen many adolescents out of school having turned away for services, like in health facilities. So I'm also looking at our probably policies, the policy makers. We have not come out strongly to advocate for these adolescents, especially on their rights, on how they can protect themselves, where can they go in case they get any challenges. We have had some of them being defiled. Those ones may not have consented about the sexual whatever. But how do we go all about this? So I think all of us as a country, we need to be blamed for this.
Yes, you're talking about guidance by the parents and talking to the young people. What kind of information does a parent has to carry to their child?
To their child?
Yes.
One, as you see your child growing, you should be able to know that at what level do I need to introduce which kind of information. Do you know that some of these children, by the time you think they don't know some of this kind of information, they have already known from friends. So it should be our responsibility as parents to know and keep chipping in at any level, at any age, where we feel that probably this kind of information is good enough for this particular age.
I want you to be specific. At what age would I start talking about sex-related stuff to a child?
I may not be able to have a quite specific age, but also looking at how your child is able to pick up things. But by the age of 10, I would start talking about issues related to sexual reproductive health issues.
How easy is it?
Of course, it may not be easy, but the more you do it, the more you get the skills and the experience.
Do some illustration for a parent. Some small illustration
for
a parent on how to introduce this kind of a topic for a 10-year-old.
For example, knowing yourself. I'm a girl, you're a boy. Okay? It's good information enough that the child should be able to know that I'm born a female and I'm a girl, you know. You're a boy and what boys should do. You should be able to talk about a girl or a boy, issues of fondling, you know, touching private parts by any person that is not you yourself or your parent. It's also not. And by the way, we talk about parents who have had parents that have had issues with their children. So giving this child information and also be able to open up that in case this happens, please let me know. For example, if someone touched your private parts, if someone touched your breast, if you're a girl, a child that is growing, please let me know. No one should see you when you are bathing, you know. That is all sexually productive health.
Okay.
And you keep on upgrading as the child is growing, but also looking at the question that these children are asking. They may even be asking you, what is sex? Why are you sleeping with your father? Mommy, why are you sleeping with my dad? Those are some of the questions that we should be able to tell these children. Otherwise, if we do not tell them at this age, other people with no information.
Mommy, why do you share the bed with daddy?
Yeah.
And you expect a parent to have an answer.
You should have.
What kind of an answer?
You should have. I'm grown up and I'm expected to sleep with your dad. But for you are still young. Or even you could ask the child, but what do you think? Why do you think I sleep? Because some of these questions come, and behind a question there is a reason. So you really, it's better that you find out why he needs to know that. Recently, my boy was asking me, Mommy, have you ever quarreled with my dad? I asked him, why did you want to know? Have you had any neighbors or any stories from your friends that they fought with their fathers? He's like, no, but I want to know. I'm like, you know what, first we are Christians and have you ever seen us fighting? No. So some of these questions the children keep asking, there are reasons. So it's better you know the reason why they're asking and then you give them appropriate answers according to the age.
What would be the package of information for, yes, I have a girl, we have failed to continue with her education, so she is at home. First of all, in terms of guiding her, what kind of information do I have to put on the table? She is 16, 15, 16.
Is it because there are no school, there's no school fees, or
for such factors? For example, she is an orphan, I'm the guardian, I have constraints, and we have failed to go on with school fees.
The school fees.
Yes. What kind of information do I have to start with in terms of guiding her? Before even what to do next?
If it's a 16-year-old girl, at this time, I would find out what she can do better, because if I'm failing...
I'll get to that.
Yeah.
But before, even because where they go to work, where they go, that's where the exposure now comes in. But what kind of information she has, we have failed to go on with school, so I have her at home. I'm thinking of where to take her, probably I've even found a job. What kind of information do I have to share with this girl first
Of course, the list may be endless, but key things that you can't forget.
Yes.
For a girl of 16, one, I would look at personal hygiene. Personal hygiene, which has the menstrual health management. As a wife, probably your wife or any caretaker at home who is a female, can also be able to take that child through that. How does that happen? And how can she be able to protect herself? Because if someone doesn't have good hygiene, she may also be predisposed to sexually transmitted infection, the whatever, and all that needs as a parent to guide this.
Got it.
Two, you need to let this 16-year-old that at the level she is, if she has started her menstruation period, she's able to produce. So issues related to sexual intercourse, she needs to be very what? Very, she needs to be aware that any time now she can be able to become a mother. So issues of prevention, how she can prevent herself from early pregnancy, how she should be able to pick up with good relationships, you know, because even she could have a girlfriend, but a girlfriend turns out to be a bad friend. Yes. So issues of relationship, those healthy relationships, how can she be able to get healthy relationships? It's also another thing that we need now to bring out clearly to our adolescents to know.
What mistakes do we make with these girls as parents, guardians, communities? What mistakes do we make in as far as handling these girls is concerned?
I think there could be many issues.
Let us share a number.
We fail.
Yes.
But one of the things that we fail as parents or caretakers, that these adolescents are growing and they are becoming sexually active.
We failed to recognize that. To
recognize that. And that is number one factor. So anything that comes around that, you see it's a problem, it's a challenge, the child is disobedient and so forth. We actually, as you suggested, you brought it forward, that we fail to acknowledge that the sexual activity, all this, they are growing up, the sexual activity, whatever is, the hormones are now working at work. And our role as parents, as caretakers, just to make sure that we guide them on what they are supposed to do. The other thing that we fail as parents is failing to help. We do not even have the information. Some of these things, we feel they are so secretive, you can't discuss with your own daughter or the person you are caretaking. You feel it's far much, it's too much. Someone else would come in and do it for you.
Yes.
Yet ideally it would come out properly from you as a caretaker or a parent to have a discussion
with this child.
And discuss about these issues of sexual reproductive health issues.
What are those things that we should look at around them? This girl, she is in your house. Yes, you have talked about starting to be careful about her sexual growth in her sexual life.
The life skills. The life skills. How is her life skills? Because we are looking at issues of a girl being open to let you know what she's going through. Have you created that atmosphere that these adolescents can be able to open up to you? So equipping these adolescents with life skills like being assertive, should be able to come out, being aggressive, to know what do they really want and probably why they need this kind of services, you know, and when to seek help in case they have any challenges. So the life skills alone, building her life skills, is really very important.
What is your view about the information girls share with peers?
Some are good, but some may not be good.
The information girls share with peers?
Yes, because if I would remember, some of the girls would tell us if you had painful menstruation periods, that the best treatment would you to have early sex. And of course, that's how some of our counterparts fell off the school track. They conceived during that period. So that's why I'm saying that some are myth. They discuss about myth, things that are not correct about their health. But some could give right information, like on how to put a pad, for example, on a panty, you know, how to treat other girls, or if you had a friend with a girl or a boyfriend, how do you manage the whole situation? So that's why I say that Some of this kind of information is good, but some may not be correct.
We're looking at things that really expose these girls to getting into these problems. So when they are at home, everybody starts thinking, how do I get her something to keep her busy?
Yeah.
How do I get her some employment? Where they go to work?
That is a challenge. In fact, recently there is a parent I met, and she wanted to keep her senior 6 vacancy, how to be busy. I'm like, why would you love that? You know, being also bored at home and what, but I'm like, how sure are you that where you are taking her, she will not be put like at a plate to another person who may not be able to know the value of your daughter. It's like, of course, it's a dilemma at the end of the day. So depending on where you place, and once these adolescents are equipped with the knowledge, they are aware of what is happening. Even if you place them in a kind of environment, they should be able to know that, oh, I can do this, I can be able to be protected, I can fight this with this, you know. Unlike someone who goes into the field or into the world and is totally doesn't know what to do.
Okay.
Yeah.
We have a lot of talk to do with sexual harassment at workplaces.
Yeah.
So here she is, very good looking at that age. Let us talk about now an 18, 19-year-old.
Yeah.
And they are young people, young men of 20, 23. Actually, this may not be even harassment, but these are people that will get attracted to each other.
To each other.
Yes. Actually, let's talk about a 16, 17-year-old.
Yeah.
How do you look at this kind of a situation? And how easy is it for the girl's safety with the temptations? Remember, she left school because of economic hardships in the house. Here is a young Davis who can provide some 20,000.
He has money.
Exactly.
He has money.
He can buy lunch and some soda and things like that.
On everyday basis.
Exactly. How easy is it to keep this girl safe in that situation?
Of course, when you look at most of these organizations or places of work, there is a policy that
in
has...
fact, you're taking it to an organization. Me, I'm looking at a restaurant.
Yeah.
I'm looking at a market, a shop, things like that. And there are these customers, there are these co-workers.
Yeah. Of course, these who are like in restaurants, shopkeeping, and so forth, that would probably deserve something else. But allow me to start with the organizations, those that are fully established. Currently, there is a policy which is called the SHARE. This is protection of sexual harassment and sexual abuse within the environment of work. It's a policy that everyone has to agree upon. I would not expect a subordinate being harassed by the boss, because there is a policy that you have to abide by. And most of these organizations have come up with that kind of policy, and it's fully currently implemented in most of our organizations. Okay. So somehow, even if this adolescent is young, somehow the policy protects, but also you, the employer, who has money, mobile money moving with money and what. By the way, sometimes there are women harassing the boys. So there is that kind of policy that protects us to that level. So for these ones who are working in shops, who are working in restaurants, areas where they sell phones and so forth, catering restaurants and so forth.
In the informal sector generally.
Yes, that's where the biggest problem comes. The employment, it's informal kind of employment. So that's why we as Reach Out, we thought that even if we empower this girl child, she should be able to respond to whatever comes out in her way. But also should also be accountable on what happens. So that's why we are looking at empowering the girl child.
Okay.
Once this girl child is empowered, then half of her problems can be solved if she's really empowered with the knowledge.
Thank you so much. We are taking a very short break. On return, we're going to look at the way forward on how we can now really protect the girls from all that we have looked at in the first segment. To you watching, it's UBC One-on-One, and this particular time we are discussing issues to do with reproductive health among among adolescents, I beg your pardon, and focusing so much on the girls that are out of school. Thank you so much for watching. Enjoy this break.
Over the years, we've dreamed to get onto the world stage. We've had that dream crushed. We've witnessed a total defeat of what could have been our greatest moment. We've felt our spirits go up, only to take a hard fall. We've had our fires burn out and leave only scars. We've seized the wind and had it pulled from our grasp. We've seen pain, and we've seen loss of the last fragments of hope. But we are made of resilience, and resilience never stops dreaming. So we will dream even bigger with the Cranes Cup Bowl 2026. Together, let's take Uganda to the next FIFA World Cup.
Together, let's take Uganda to the next FIFA World Cup. For every Now Special you buy, we will give 50 shillings to the Uganda Cranes 2026 fund. You will also get the chance to choose how the Cranes Cup Bowl contributions are spent. Now Special, official beer of the FIFA World Cup and official beer partner of the Uganda Cranes.
Alcohol is not for sale to persons under 18. Please drink responsibly.
UBC One-on-One, thank you so much for watching and welcome back from the break. We are with Miss Nantondo Rebecca Bagala. She's from the She Soars project, and we're discussing issues to do with reproductive health among adolescents, especially girls that are out of school. In our first discussion, we really looked at the risks that expose them to issues to do with reproduction and hence reproductive health. We now want to know what exactly can be done to protect the girls and the boys as well from these risks and the problem in general. Thank you so much for following, and don't go anywhere. Welcome back from the break.
Thank you.
Yes, as we have girls in communities that have failed to continue with school due to various reasons,
Yeah.
we still have boys who have failed to continue with school due to various reasons.
Yeah.
So these are people who meet.
Yeah.
How do we protect the other, protect them from each other?
From being what?
How do we protect them from each other?
From
in
each
as
other.
far as ending up as parents is concerned?
Yeah, I think I've talked a lot for the girl child, but I'm looking at now the boy.
Yes, we're bringing in the male side.
Yeah, the male side. Usually we have done a lot with the girls and we forget about talking to the boys, and we forget that these are the future husbands, you know, the future boyfriends.
Actually, they are the risks.
The risks, you know. So what we are also finding out that we are looking out to these role model boys or role model men who are also equipped with information to help support their counterparts. If you're a man, you should be able to take care and support the woman. Or if you're a younger boy, you should also be able to see how you protect the counterpart who is the younger adolescent or the girl.
You see, that saying is so common.
Yeah.
The boys, the men should help to protect the girls. How? Can you help my viewer to understand?
Yeah.
How can a boy protect the girls?
One, if you see me being probably moving in an area that is risky, if you are really a responsible boy, wouldn't you protect me?
How?
I
need to understand that protection that is expected from the boys.
That is one of it, that you should be, I should be like your sister. I should be protected. Remember, men, you are very aggressive, unlike for women. If you saw any act or someone is defiling me, wouldn't you come in to rescue? You know, you could be passing somewhere, an area where there are a gang of these drug abusers, you know, and you see they are harassing this girl. Wouldn't you come and discuss or talk and advise these other boys that what you are doing, the act is not good? Two, if we are in a relationship wouldn't you protect me from getting pregnancy? Wouldn't you protect me from not getting the sexually transmitted diseases? You know, that's where the counterparts, the role model boys and men come in.
Okay.
Yes.
So we are looking at the girl child and how things can go wrong and she ends up a mother.
Yeah.
First of all, how can we protect her from these problems? Let's start with looking at herself.
Herself.
Yes.
Of course, protection or safety will start with an adolescent.
What does she have to do?
One, they need to seek to know things around them and what can be done around that. The other issue, they should also be able to know where to get services from, just in case they get challenges. But even before you get challenges, you should be able to know where are these services. For example, if I needed
know the services first. Then where to get them.
Where to get them. Which services do I need and where to get them. And this is all available in most of the areas. For example, for youth that is not out of school, we have health facilities within our localities. You could go to one-to-one even if you are not sick and get guidance, get counseled, you know, before things get worse.
Okay. And
also, they should be able to advocate to what they need, because as parents, we may think that what we wanted before in our 1900 is what they need now. It could be something quite different.
Yes.
As for their period. So they should be able to advocate for better services within the either health facilities, for those that are in school, whether they're in school, even talking about this in making sure that whatever they need can be included in our policies or in our guidelines as a country. They should be able to advocate and come up and speak as adolescents.
You see, we're talking about people that have even failed to continue with school due to different reasons.
Yeah.
Where do they get the voice to be heard?
By
people like even policymakers.
Do you know that most of these youth out of school have become counselors, area counselors?
That is true.
Because being out of school, I may be out of school when I'm senior 2, senior 4, senior 6. I may not necessarily that I've totally failed to go to school. I may have dropped out of school due to some reasons. So these are kind of youth or adolescents that need to come out and advocate for the adolescent-friendly services, whether within the health facilities, whether to be inclusive in our policies. They should be able to come out and tell us, this is what, guys, this is what we need.
When you talk of quality services, can you really break them down so that we get to understand what are those quality services?
The quality services, I'm thinking if you are probably, I'm talking about the health facility because I'm more commonly attached to a health facility.
Okay.
Yes, I'm looking at a good adolescent-friendly service. You should be able to have healthy care providers in there that are adolescent-friendly. You should be able to have the STI screening and diagnostic tests and their treatment. You should be able to have health information, whether in cases of brochures, information that a youth can have at a time even if you are not there. You should be able to have a call toll-free line. For example, if I'm in the community, probably in my Katogo there, Kasenyi, I should be able to make a call that is toll-free, and I should be able to access information at any time that I would wish.
From any platform.
Yes. You should have a good peer support kind of services. You know, for us as adult health workers, we may not be able to provide what these youth or adolescents require. But a peer can be able to understand what a youth is going through, what challenges, and what better services they can have.
Okay.
But of course, all the commodities that are required. For example, if I want to screen for pregnancy, I should be able to access and find it in a healthy facility.
Me, the parent who has this girl, what is that role that I'm supposed to play to ensure that she is safe? I keep her safe from any exposure to any of these problems.
Of course, as a parent, other than the information which we have over discussed about, you are a watchman. You are a watchkeeper. You must be knowing what goes around this girl, what goes around with this boy, what kind of friends is my daughter, is my son getting in touch with? If the activities, which kind of activities they are doing? If they are watching some programs on the TV, which kind of programs are they really?
Watching.
Yes. Are they health related? Or this could be some of the programs that are even making things worse at home.
True.
So as a parent, you're a watchman, you're a protectee, you need to protect these girls or boys within your household.
Okay.
And keep engaging them in health-related matters.
She has ended up pregnant.
Yeah.
And she now is a mother. How different is that handling now? I have a mother,
Yeah.
a teenage mother in my home.
And that's where, Jordan, we go wrong. That this is the period now where this adolescent even need you more. But it's a period where you find most parents get detached. And that's where we lose it all. This is where you need to bring this adolescents that despite whatever, yes, despite whatever has happened, life has to continue. And give these people hope for the future.
But this is somebody I try to pay school fees.
Yeah.
For example, if she got pregnant in school, definitely how do you expect the parent to react? To bring this child closer? Are you being real?
Yeah, I'm real. And the challenge we have as parents, that we are not empathetic and we forget our past own experiences.
Okay.
If you look at, I don't know what is the statistics, but I'm looking at a family, how many families really started having children when they're in the whole
Out of the
rightful formal kind
of getting married.
Yeah, we forget our past and we push all the blame and whatever we are seeing currently as an issue. So this is where
maybe we don't want what we went through to see our children going through.
But this has already happened. In fact, if I'm to blame, you as a parent, you are fully blamed for these adolescents to become or to conceive early.
Okay, she's already here, a mother.
Yeah.
You say I should embrace her.
Embrace.
What do I have to do else?
Counsel. This is when she needs a lot of counseling. Do you know if you don't bring this adolescent, the next thing you will see, she's going to have an abortion. And you know how risky an abortion is. So she may disappear from home. As a parent, that is a psychological torture to yourself.
Yes.
But also you have given psychological torture to
the
girl. On top of that, you are forgetting the grandchildren, the grandchild that she's holding. Once there is already torture from outside, that they also get part of that. So, and that is not the best way. The best way should be to bring her closer, help her access the services properly where she needs to get services, and then life can continue after that.
You talked about health workers and how they treat these young people.
Yeah. I'm not saying all health workers,
yes,
but the majority. But there are few that are knowing what to do.
What is the right way of handling them?
I don't know whether it's really the right way, but the ideal.
Okay.
Ideal is to receive an adolescent that comes to the health facility with all the care and concern that you would give to an elderly person or an older person. The reason by the time this adolescent's walking into your health facility, she has reason. In fact, you would even thank the adolescents from coming to the health facility. To me, that's good enough.
They would do worse
if they had not come, because we don't know how many. They have chosen to come. So you should give them the best services that they would receive.
Okay.
Then finding out what exactly they want to discuss, if there are issues, but also making sure that whatever you discuss should be confidential. You will find some of the health workers, they have discussed the issues within a consultation room, and you find before you know it all, can you imagine, this adolescent who has come, she has been defiled. Now everyone have to peep through the windows and have to look, and of course as an adolescent, these are some of the things that they get annoyed, and you are like, I may not come back into the health.
How about sharing this information with these children's parents?
That is after their consent. It depends on how severe the situation is. There are some information that even you don't need to.
So my child may stop the doctor from telling me that she's pregnant?
Yeah, she has a right. She has a right, unless when you see that the decision she's making may affect her health. But if there is no any negative outcome out of the decision she has made, there is no need for you to discuss kind of issues, because at the end of the day she will lose the confidence in you, and next time she will not be able to discuss more further probably bad issues to you as a health worker, in fear of you disclosing whatever she's going to discuss with you with her parents or caretakers.
Okay. Let me now look at She Soars, your project. What are you up to in this very line of protecting and saving children from being early parents?
Yeah. As a project of She Soars, we are supporting adolescents out of school with sexual and reproductive health and economic empowerment. But also in addition that, to let them know about their rights as adolescents out of school, but also to build their skills.
Okay.
Yes. To be economically empowered.
What do you do with economic empowerment, and what is it all about? What does it entail?
Yeah, the economic empowerment, we want to change the mindset of adolescents on how to save, to teach them about saving.
Yes. And
issues of getting loans out of the little savings they are making. It's a new term that we are bringing on board, that it's called YSLA, that is Youth Saving and Loan Association.
Okay.
It's for young children, as you say, youth, unlike the other VSLA concept, which is for village savings and loan association for adults. But here I want to train that these out of school adolescents, some of them are working, but how do they be able to start saving and be able to make sure that their economic status keeps on improving through saving and getting loans out of the savings group?
You say some are working, you even talk about the loans that they take.
Yeah.
But what kind of jobs do they literally do with this money?
Yeah, some of these youth out of school, they have stalls. Some of these youth out of school, they are the maids, the helpers. Some of these youth out of school, they could be GBV survivors, and they are earning at least some little money out of whatever they are doing. So most of the youth that we have, it's like mereyalero, you know, whatever they work, they
from
eat.
hand to mouth.
Yeah, mouth to mouth, you know. So this is a concept that helps to change this youth, that saving is very good, but it may not only stop about saving, but you can also get loan to start off small businesses. You can be able to build it up slowly and slowly, that you can become rich, but not a once off, but you can build it slowly as you start.
Till you get there.
Yeah.
So you give loans, you empower, and even share the information.
We do not give loans. The smaller saving they are making.
You help them create groups.
Groups, yes.
Where they save the money.
Yes.
How much has this yielded in terms of results towards the goal that you look at as an organization?
It's something that we are looking out, and probably shall be able to share this kind of experience after the project has ended. It's something that it's new, we are introducing to these youth. We see how it will come out, how the results would be. But of course, also being that they are adolescents, we want to see how their parents also help them saving, because some of these youth may not be working, but their parents are working. And some of these little saving can even be helpful, either to buy books or to take them back to schools, those that can be affordable within their means.
Okay.
Yes.
So how old is She Soars? In the first place, tell us She Soars in full.
Thank you very much, Jordan. She Soars in full, it's an acronym.
Yes.
But it's an abbreviation that stands for the She is sexual and reproductive health and economic empowerment. SOAS is supporting out of school adolescents' rights and skills.
Okay.
That is the word She SOAS. And it's a project that is 7 years project under Care International, Uganda. However, we are sub-grantees as Reach Out Community Health Initiative. We help to implement because we are closer to the community.
Okay.
And so far, the 2 years have elapsed. In fact, the 2 years is ending on 31st March 2023.
Okay.
So we shall have 5 years ahead of us, which is not a
to finish
short
the
time
implementation.
to finish the implementation. And we are looking out to see a lot of activities being done and see how they are working out for these youth out of school, and then probably be able to appreciate and share the best practices out of the project implementation and share with the country as large, but also within other implementing partners.
What is the scope of your operation like?
Yeah, the scope of operation currently, the SHISHOAS program in Uganda, because it's in 3 countries, in Uganda, Zambia and Kenya.
Yes.
But in Uganda we are operating in Kampala city, capital city. We are operating in the north, that is Terego district. We are operating in Madiokolo district and Arua city.
That is West Nile.
West Nile. However, in Kampala, it's Reach Out Mbuya Community Initiative that is operating within Kampala capital city. And we are working in 2 divisions. That is in Akawa division and the Makinde division.
Okay. So far, like, could you tell us the kind of cases that you have so far handled and they are successfully handled? Do you have those cases where you boast of having worked on them and the results were really good? One,
as a project lead, something that had literally do not anticipate was I thought we do not have a lot of youth or adolescents out of school. But so far the mapping and identification that we have done, goes together with the district health officers of Nakawa and Makindye.
Yes.
We have identified that the problem is so diverse and no one can be able and come out to say that I can be able to achieve this alone. This requires a multi-sectoral kind of approach, that as I'm bringing health, we need the people who could come in from probably the gender perspective and come to help in issues related to gender and ensure that services that we render are gender sensitive and inclusive. We need also to look at the government, the governance at large, coming in also to help these adolescents, because the problem, the magnitude of the problem is really huge.
Who is funding you as an organization?
We have various funders, but for the SHISHOAS project, our funders are basically from Global Affairs Canada, and we get the funding through CARE International Uganda.
Okay.
Yeah.
You talked about policy when we were looking at the challenges and the problem in general.
Yeah.
What is the role of government in protecting these girls that you were talking about? Government and all the leaders, and where do you think is their role, and do you think they have really played it?
I would say yes, though it may not be to its full capacity.
What is the role and where are the gaps?
The role would be to strengthen, ensure that these policies, especially for those who are probably violating rights of these adolescents, are strengthened and being ensured that they are handled appropriately. That is something that we need to really strengthen. The other thing, we also need to see the government coming in to help these rights organizations, those organizations that are fighting for the girl child, for the women at large, come up and they are supported to come up and help and support these adolescents or women who are really very vulnerable.
Yes.
Yes.
We thank you so much. What would be your closing remarks as we wind up?
I would like to thank you very much for this opportunity as UBC.
Yes.
Thank you very much for giving us this big audience.
You're most welcome.
The viewers of UBC, thank you very much for tuning in. But also want to thank all the implementing partners, especially the SHISHOAS project partners, the Restless Development, the UAF, the Naguru Teenage Center. CARE International, thank you very much for choosing us being part of your implementers in this project. And of course, the Global Affairs Canada for giving us the funds. But also I'd like to appreciate our peers who are really helping us to roll down this kind of training for sexual and reproductive health among their fellow youth. Thank you very much. And I really want to see a changed adolescent out of school, and also be very grateful to share some of these impacts that the project have made, together of course with the CARE International Uganda to fellow Ugandans to see what can be achieved within the means that we have.
We thank you so much for coming.
Thank you very
and
much.
all the information that we have shared to you, the parents, the girls, and everybody in the communities where we stay. This information is for your own good, for your own use. And I hear people say, when you save a girl, you have saved the nation. So take this information in that direction. Her name is Miss Nantondo Rebecca Bagala. She's the project lead, She Soars, and they based at Mbuya Community Health Initiative. That is it. We thank you so much for watching. That is all we had for you this evening. Enjoy the weekend. Bye-bye.